I'm Dr. Robert Friedman. I am a physician and professor of psychiatry and pharmacology at the University of Colorado School of Medicine. I would like to share with you how my research group discovered that choline, given before birth, helps babies develop their brain and decreases their risk for future mental illnesses. In the description of this video is a link to part 1 of this series where I talk more practically about what choline supplements you can take and when to start them. Preventing mental disorders before birth, what expectant parents might want to know, or could choline help prevent schizophrenia? The current treatment of schizophrenia is limited. Signs usually emerge in adolescence, earlier in boys than in girls, but early recognition and treatment in adolescence may prevent suicide, but otherwise does not affect how the illness emerges. Medications are helpful for controlling symptoms, and we recommend them, but the side effects are considerable, and few people have complete remission of their illness and return to fully productive lives. There is no cure for schizophrenia. As a psychiatrist, I was quite aware of these limitations, and as a neuroscientist, I decided to see what I could do in my own research to try to find better treatments for schizophrenia. Clinical research always begins with a patient, and we're going to begin with Professor John Nash, the only person with schizophrenia to receive the Nobel Prize, as he is depicted by Russell Crowe in the film A Beautiful Mind. The tagline of the film is he saw the world in a way no one could have imagined. As a genius, Nash cracks a coded transmission from Moscow, but then he develops the belief that Big Brother is controlling him. This belief will begin to overwhelm his mind as he descends into paranoia and psychosis.
Right this way. We've been intercepting radio transmissions from Moscow.
The computer can't detect a pattern, but I'm sure it's code.
How's that, gentlemen?
Ever just know something, Dr. Nash?
I need a map.
46 13 08 67 46 90. Starkey Corners, Maine. 48 0301 91 26 35. Prairie Portage, Minnesota. These are latitudes and longitudes. There are at least 10 others. They appear to be routing orders across the border into the U.S.
Extraordinary. Gentlemen, we need to move on this.
Who's Big Brother?
Nash glimpses someone in the shadows and believes that he is Big Brother. Nash believes that Big Brother is spying on him and threatening him, and his wife Alicia is devastated because she now realizes how sick and paranoid her husband has become. He saw the world in a way no one could have imagined because his mind registers everything as important, both the code that he's asked to decipher and the image that he barely catches a glimpse of someone in the shadows, whom he then registers in his mind as Big Brother, his enemy. A common feature of Nash's genius and his psychosis is his low sensory inhibition. And so we decided that that would be a feature that might be amenable to neurophysiological research. Low sensory inhibition affects attention not only in schizophrenia, but also attention deficit disorder, where children complain that the classroom is noisy or that their brain is like a carousel with each new sound pushing out the last sound or instruction from the teacher that they should have been registering. Autism, where children complain of hyperactivity, of hypersensitivity rather, and painful responses to sounds and noise. And bipolar disorder, where patients are seen to be distractible and have poor filtering of sensory information. In order to study this neurophysiologically, we decided to record brain waves from subjects by placing EEG-type electrodes on their scalp. The brain waves are sufficiently strong to be recorded through the scalp and the skull. We then gave the subject paired sounds, click, click. The first sound engenders a brainwave response, which you can see here for the control or healthy subject. The second sound produces much less of a response. The reason for that is that during the response to the first sound, there is not only activation of neurons that respond to it and generate the brainwave, there is also activation of an inhibitory network, a network of inhibitory cells that protect the brain from repeated stimulation. We have so much to register in our brain. To see something that's repeated and seemingly meaningless and try to process it over and over again, unless we had the genius of Professor Nash, would be pointless and distracting. In schizophrenia, however, there's a response to the first sound and a response to the second sound. And so people with schizophrenia appear to be lacking this inhibitory network. You've seen now the tracings on the left. We were able to take this kind of sensory stimulation and reproduce it in animals, where we could record the responses of individual neurons. These large green pyramidal cells in an area of the brain called the hippocampus are the ones that respond to sound. And the inhibitory network is represented by these blue interneurons. The activation of the pyramidal cell and the activation of the interneuron happen at the same time. So the pyramidal cell has time to respond to the first sound, but then the inhibitory neuron begins to shut down its responsiveness. Like any system in the brain, it can be turned on and off. There are times when we want to register everything. For example, if you're looking for someone in a crowd, then the system is turned off. On the other hand, you might want to be studying in a noisy environment. Then you'd want the system turned on. And so the brain has an input called a cholinergic input, which uses the neurotransmitter acetylcholine to turn it on and off. The acetylcholine comes from other cells deeper in the brain that are more concerned with what your state of alertness should be at any given moment. Acetylcholine works on inhibitory neurons because it activates a particular receptor on these neurons. At first, this receptor was not well characterized, but we and other neuroscientists around the world who were working on it eventually characterized it as the alpha-7 nicotinic acetylcholine receptor. Alpha-7 because it was the seventh to be discovered, acetylcholine receptor because it responds to acetylcholine, and nicotinic is in there because nicotine works in our brain by hijacking certain classes of acetylcholine receptors, including the alpha-7 nicotinic acetylcholine receptor. We thought we had done a pretty good job of unraveling the neurophysiology and neurobiology of this system, but we were chagrined to learn that people with mental illness knew this already because they were smoking more heavily than any other group, using high levels of nicotine to temporarily activate what turned out to be a decreased number of alpha-7 nicotinic cholinergic receptors in many patients with schizophrenia. They found that these high levels of smoking very temporarily helped them focus their attention. We wanted to understand more about why the alpha-7 nicotinic receptor was reduced in schizophrenia, and so we began to sequence its gene. This is the genetic code of part of the alpha-7 nicotinic receptor. You see the A's, G's, C, and T's, which are the letters or nucleotide base pairs of the DNA molecule, the way that information is encoded in DNA. This is a region of the alpha-7 nicotinic gene called the promoter. The promoter is responsible for telling the gene how much to make and in which cells to make it. And every one of these red arrows is one where we found a difference in the sequence between some individuals and the more common sequence. And the bulk of these red arrows were found in people with schizophrenia. So they had a change in the promoter. Most often these changes resulted in the promoter being less active, so that this genetic difference would be responsible for the individual having fewer alpha-7 nicotinic receptors. As we were working on it, Dr. Sherry Leonard, shown here with me looking at a DNA molecule, got very excited. She said, "We just received a new fetal brain library." As the person primarily responsible for sequencing the DNA, Dr. Leonard knew that it is easier to sequence DNA when it comes from the product of a tissue that's actively using it. And what she told me is that no tissue uses the DNA for the alpha-7 nicotinic receptor more actively than the fetal brain. She says everyone knows fetal brain uses genes much more actively than any other tissue. I should say, by the way, a library is a collection of DNA molecules in a test tube. Nothing more than that. I began to think about what she'd said, and as I thought about it in the shower next morning, I realized we had made a mistake. We were trying to use the genetic information to develop better treatments for schizophrenia, when what we ought to think about was better prevention before birth, when the genes are the most active. As much of a miracle as it is that we are able to run our brains and do so much thinking, planning, artistic ability, it's even more of a miracle to think that just based on the DNA code alone, with no instruction, the 20,000 genes we inherit from our parents produced a brain with all 85 billion nerve cells in place, and all of the connections formed, at least initially, in the 9 months before birth. That's an incredible feat of engineering, more powerful than creating any AI device, and yet done only with the genetic code. So building the brain before birth might be a time where we can improve it, but operating the brain after birth might be too late to change it. When we looked at the alpha-7 receptor itself, it was obvious, and other people had shown this, that it was higher in the fetus than it was in newborns, children, teenagers, and adults. So by the time the baby was born, the ball game was over. The brain had been built. The alpha-7 nicotinic receptor, for better or worse, had done its job. And operating the brain after birth was fine, but it was not the optimal time to intervene. And so we immediately changed over our laboratory to study the double-click paradigm in these folks. Now, our laboratory was used to recording from some difficult people. Paranoid people, people who believed that we were secretly giving them electroshocks through the wires attached to their head, people believing that we were sent by the CIA to read their brains, but they were nowhere near as difficult as an individual like this one in the upper left-hand corner, who screamed at us, enraged, pulled off the electrodes, was altogether fussy. But there was an easy way to gain control over their behaviors. We handed them back to their mothers, who fed them, rocked them, and put them down for a nice 2-hour nap. And during that nap, they slept like babies, and we could record as many evoked potentials as we wanted without disturbing them. So already at birth, these children were responding to the first sound and inhibiting the response to the second sound, unless there was a psychotic parent, a father or a mother. And then we saw a number of children who responded to the first sound and to the second sound. It was stunning to us that a physiological problem that we had identified in schizophrenia would already be present at birth in a child. Now, you've seen the diagram in the upper left-hand corner. We decided to go look to see in fetal brain to see exactly what the alpha-7 nicotinic receptor was doing to produce inhibition before birth or the lack of it. One thing we see that's obvious is the alpha-7 nicotinic receptor is now spread all over, not only on interneurons, but also on the pyramidal cells themselves. But there's something missing. There is no cholinergic innervation yet. It has not had time to grow up from the brainstem. So there were two questions. What was activating these alpha-7 nicotinic receptors? And then what were they supposed to be doing? The answer to that was that choline, pumped in by the placenta, would reach very high concentrations in the fetus. And at these very high concentrations, it was able to activate alpha-7 nicotinic receptors, just like acetylcholine would later once the acetylcholine came in. But the choline levels had to be very high. What do the nicotinic receptors do before birth once they're activated? It turns out that other scientists had discovered that alpha-7 nicotinic receptors help install a nerve cell upgrade. They add faster speed and more inhibition for the brain. Early in fetal development, the connections between nerve cells are designed to work slowly and to be deeply excitatory. So there's a slow, deep excitation between neurons, which is good because that helps cement their connections. Waves of electricity from this excitation go back and forth across the brain, helping the brain develop. After birth, it's much more important that the brain begin to process information very quickly, so it needs a much faster excitation, and one that's not as deep. It also needs inhibition, which is pretty much lacking in the fetal brain. Those inhibitory nerve cells have to start doing their filtering. Improving these two functions, excitation and inhibition, requires upgrades to the nervous system, and it requires installing new proteins that can help mediate fast excitation and inhibition. Just like your computer, as you buy a bigger computer, often comes with an upgraded operating system, so too for the brain. As it grows in size throughout fetal development, it has to continually upgrade its operating system. And alpha-7 nicotinic receptors activated by choline are responsible for that final installation of the operating system that will be used by the person for the rest of his or her life. If we look in the brain after death, of course, in people who've had schizophrenia during their lifetime, we can see that this upgrade, which should have been completed before birth, is not fully completed. So we came up with a hypothesis. If there were normal receptors, normal choline levels, there should be normal brain development. If there were fewer receptors, however, perhaps because of a genetic problem in the alpha-7 nicotinic receptor gene or some other gene related to the alpha-7 nicotinic receptor, and there were lower choline levels, perhaps because the mother was stressed, which tends to cause her to hold the choline in her own body instead of making it available to the baby, then there would be abnormal brain development. But if there were fewer receptors and we gave a choline supplement, then there might be normal brain development. Well, the FDA thought that was a good idea, and so did NIH, so we got permission from the FDA to do the trial and funding from the NIH to do it. And we began with 100 women, 12 to 14 weeks pregnant. We could already see that the pregnancy was proceeding normally and they had no apparent illnesses. The reason for choosing healthy women is that prenatal prevention is designed to be given to all women because we can't predict who's carrying genetic risk for schizophrenia. We can't predict what problems they'll encounter during their pregnancy that might increase the risk of schizophrenia. Infection from flu or perhaps even from COVID is one of those factors. We blindly randomized the women to choline or placebo. So 50 women got choline capsules, 50 women got identically apparent placebo capsules. Everyone got prenatal, all the other prenatal vitamins, including folic acid, and choline dietary guidance. Now, why would we want people on placebo to get choline dietary guidance? Because this is a trial in human pregnancy, and we did not want any baby deprived of choline. And so an obstetrical nurse went into each household 3 or 4 times during the pregnancy to talk with the mothers about eating more choline-rich foods and to check their pantries and refrigerators to see if they were available to them. She, like the rest of us, was not aware of who was getting choline and who was getting placebo. Just before the trial, this phase of the trial was about to end, Julie, our head nurse, came in to see me. "Oh, Dr. Friedman," she said, "I've been feeling bad about this for a while." And I said, "What's wrong, Julie?" "You've worked so hard on this trial, and I've wrecked it for you." "What did you do?" I said. "I made sure that every one of the women ate as much choline-rich food as they possibly could. There's no way that you are going to see any difference between whether they got choline or placebo." And I said, "Julie, that was your job. And if we have 100 healthy babies, and that's the result of the trial, then we'll both feel good about this." Well, let's look to see what actually happened to the babies. Despite Julie's best efforts, infants treated with choline, when we recorded them at 1 month of age, most of them were responding to the first sound and decreasing the response to the second sound. But if the infant came from a mother who had been treated with placebo, it was more likely that the infant would be responding to the first sound and to the second sound. So choline's effects were already apparent just after birth in having more babies be more likely to have inhibition in our paired click test. If we fast forward 3.5 years, we can now rate attention and social withdrawal, 2 of the characteristics that are related to the infant's ability or performance on the 2-click test. Babies whose mothers took choline, particularly males, were less likely to have problems with attention. They were more likely to be able to spend longer with their toys absorbed in them. They were less likely to be distracted. They were also better able to shift their attention if they were supposed to put the toy down and then clean up, or if someone came in whom they should be going over to see. Social withdrawal means that the infant has problems relating to other children, playing with them, is more likely to shy away and try to be isolative, may not bond well with brothers and sisters, caregivers, teachers, or even the parents themselves. Problems with social withdrawal were also reduced in both males and females. You may note that males on placebo don't do very well at all. Females do better, but there was still improvement in both sexes if the mothers had choline during their pregnancy. And these improvements were lasting for 3.5 years in this particular test, and others have shown that they last for at least up to 7 years, as long as anyone has been able to look. Now, is this going to be sufficient to prevent schizophrenia? Well, if we look at the amount of improvement of social withdrawal here in red and attention problems here in blue that we were able to obtain with choline in 3.5-year-olds, we can compare it with studies done by other investigators who started with adults who had schizophrenia and asked parents to look back and rate them at 3.5 and 4 years of age, using exactly the same rating scales that we used. As you can see, patients who developed schizophrenia compared to those children who did not had increased social withdrawal and increased attention problems. Have we swung the needle well enough in the other direction with choline to prevent schizophrenia? You'll have to check back in about 25 years, about 2050, for an update. But we do know that we have put these children on a pathway to much better health. Or as one of our child psychiatrists, Dr. Randy Ross, said, these are really great kids. Now, do children of mothers with lower choline during pregnancy have a higher risk of schizophrenia in adulthood? We were able to look at that in 3 groups. Compared to whites, Black Americans and Native Americans have lower levels of choline during pregnancy in the mother's bloodstream. This is less reflective of the foods they eat and more reflective of how much stress these mothers are under. Black American mothers and Native American mothers, particularly in poorer neighborhoods, describe chronic stress from the effects of racism, early childhood adverse experiences, and other problems in their socioeconomic situation that are less frequent in whites. The relative risk of schizophrenia in adulthood in repeated studies across the U.S. for Black Americans is twice as high as it is for whites, with intermediate figures for the Native Americans. So it appears that mothers with lower choline levels are more likely to have children with schizophrenia than whites with higher choline levels. Now, an early problem in attention does not always mean future schizophrenia. We don't want people to assume that because their child is having problems playing with toys for an extended period of time early in childhood, that child is destined to grow up to have schizophrenia. For our male children in our studies, for 2/3 of them, the mothers would record at least one problem with attention. By 4 years of age, about 1/3 of these children had enough problems to be in a level that is considered concerning. But only half of those developed full attention deficit disorder when they reach school age, and only 1% are expected to develop schizophrenia as they reach adulthood. So looking back from those individuals who had schizophrenia, they are all likely to have had attention deficit problems as early as 18 months of life. But looking forward from all the children who've had attention deficit problems early in childhood, only a few will develop schizophrenia. Nonetheless, we think if we can decrease the number of attention problems earlier in childhood, we perhaps can prevent some of these children from going ahead to a full schizophrenia. How do we then put the effects of choline into some perspective as a preventive measure? The model for me is heart disease, which Deaths from heart disease have decreased by over 50% over the last 7 years. Diet, exercise, and smoking bans are primary prevention, things we do for everyone to try to lower the risk of heart disease over the lifespan, beginning in childhood. Then, as people reach middle adulthood and begin to have signs of problems that might lead to future heart disease, we intervene. Statins for high cholesterol, blood pressure medications for high blood pressure, and weight loss drugs for obesity. All of these are now known risk factors, and so this is secondary prevention. Tertiary prevention means intervening after a first heart attack to prevent future heart attacks. Things like automatic external defibrillators to save the person's life, or stents, which will also save lives and prevent future heart attacks. Together, all these things working together have decreased the risk of death from heart disease by over 50%. What can we do for mental disorders? We already have some things that are primary prevention: prenatal vitamins, vaccinations, seatbelts, bike helmets. And we believe that choline should be added to these as one of those positive steps, simple and inexpensive, that can be taken during pregnancy to try to be primary prevention for the later onset of schizophrenia. Secondary prevention would be recognizing the signs and symptoms as they appear in early childhood. Troubled children are identified by parents and teachers and can be given help that may enable them to prevent early suicides and perhaps better response as the illness increases. Finally, tertiary prevention. For those who get ill, better access to therapies and hospitalizations can prevent recurrences and the illness from getting more chronic. If you would like more information about choline and prenatal prevention of mental illnesses, please visit our website, robertfriedmanmd.com, which also contains practical advice for women who are expecting or planning to expect children. A few disclosures: this presentation is for educational purposes. Only your doctor can provide medical information. I have no commercial ties with any nutrient companies, including those that make choline, and all our research was regulated by the U.S. Food and Drug Administration and funded by the National Institutes of Health and the nonprofit Institute for Children's Mental Health. And finally, I'd like to thank my many collaborators and other contributing scientists to the knowledge that I've tried to give you today.